Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of pre-existing drug therapy. In pre-existing drug therapy, if the patient is on levodopa should be continued. If the patient is on Viagra or sildenafil, this sildenafil should be stopped 24 hours before the surgery. If the patient is on hypoglycemics, that is oral hypoglycemics, then in oral hypoglycemics we should ask the person to omit the morning dose on the day of surgery, because the patient is in fasting for almost 6 to 8 hours. Then if the patient is on insulin, we should continue the insulin with modification based on the blood sugar levels. If the patient is on oral anticoagulants, like for example, if the patient is on warfarin, in the warfarin we should ask the patient to stop warfarin 5 days before the surgery. If this stopping warfarin 5 days before surgery is not possible because of coagulative risk factors, in such cases we should shift the warfarin to low molecular weight heparin, and this low molecular weight heparin should be stopped 12 hours before the surgery if it is a prophylactic dose. If it is prophylactic dose, then low molecular weight heparin is stopped 12 hours before surgery, and if it is a therapeutic dose, that is more than 4000 international units per day, then we should stop low molecular weight heparin at least 24 hours before the surgery. In warfarin, if the patient is on warfarin and if the international normalized ratio or prothrombin time is less than 1.5, and we should do emergency surgery, and if we cannot postpone the surgery and the INR is less than 1.5, in such cases we should continue the surgery by giving the patient fresh frozen plasma. Other anticoagulants like rivaroxaban and dapigatran should be stopped 72 hours before surgery. So the drugs. Levodopa is continued toward the surgery. Viagra or sildenafil is stopped 24 hours before surgery. Oral hypoglycemics, we should omit the morning dose. Insulin is continued with modification. Oral anticoagulants like warfarin should be stopped 5 days before surgery. If it is not possible, then we can shift the patient to low molecular weight heparin, and we should stop 12 hours. This low molecular weight heparin should be stopped 12 hours before surgery if he is on prophylactic dose, and it should be stopped 24 hours before surgery if the patient is on therapeutic dose. If the patient has warfarin and if the INR is less than 1.5, normally we should stop the surgery, but if it is an emergency surgery and if it cannot be stopped, then we should give fresh frozen plasma is given to the patient. Rivaroxaban and dabigatran are stopped 72 hours before surgery.
thank you and thank you for watching.